Hi, well, I'm George Edwards. I'm a retired child abuse pediatrician. I practiced at Adele Children's Medical Center in Austin, Texas, and I served on the faculty in the Department of Pediatrics at the Dell Medical School at the University of Texas at Austin. There are uh, actually quite a number of injuries that are associated with shaking of infants and young children. But the main one and the most important one, the most tragic one, is brain injury, brain damage, uh, and it can be severe, can lead to lifelong disability, and it can even lead to death. But there's actually a fairly long list of other injuries that are associated with shaking. Uh, there's bleeding uh, in what's called the subdural space. It's bleeding between the brain and the skull itself. There's bleeding into the layers of the retina, referred to as retinal hemorrhages. Um, there sometimes can be neck and spine injuries, including ligamentous injuries along the neck. There can be injury to the spinal cord itself. There can be bony fractures, uh, most commonly of the ribs. There can also be bony fractures of the extremities. Um, and there can be skin injuries, bruising. Uh, so all of those injuries can be associated with and are associated uh, with with shaking, but by far the most serious injury is the brain injury that occurs.